zoom my recording and introduce Madison. So can y'all see Madison on the screen? Madison, she's right there waving to us. Madison is with Levine Hearing, and she's our specialist today. She's going to be talking to us and telling us all the things we need to know about tinnitus and about some hearing issues that you may or may not have. So I'm excited to have, because this is something I don't know a whole lot about. I know Todd said he had some issues, so he was excited to learn, but we're all excited that you're here with us today, Madison. We greatly appreciate it. And if you have or need to share your screen, you can do that, or you can just talk to us directly. Is everybody, you have the choice to have her on speaker view or gallery view where you can see everybody. Just want to make sure you can see Madison. And Madison, go ahead and get us started. Thank you for coming.
Absolutely. Thank you, guys. Can everybody hear me right now?
Loud and clear.
Excellent. Okay. So first, I want to say hi to everybody. Todd, Bob, David, Adrian, Pat, Joke, Barbara, Vera, Karen. It is so nice to see all of you guys. Thank you for joining me. So my name's Madison, and I have a hearing aid clinic near the Arboretum in Charlotte. It's called Levine Hearing, which is my last name. And we have been here for about 5 years. So July 2015, I opened it. And so I have seen a lot of people come through my doors with tinnitus or tinnitus. You can say it both ways. They are both correct, which drives me a little crazy because I would love for one to be correct, but so what I'm going to do today is go through a little bit of a PowerPoint presentation. I'm going to try to make it not boring, but it's got lots of really good information for you about the causes of tinnitus and some potential ways to lessen it, and mostly mentally how to handle it, because it's more of a mental game than anything else. So let me start off right off the bat by sharing my screen with you, and I hope that this is gonna be easy to see. Okay, so you can see my face on that screen. So this is aptly titled, "The Bells Are Ringing." So if you have ever experienced tinnitus yourself, you might have heard bells, you might have heard other sounds. And I'll tell you, I myself have experienced tinnitus. It can happen at any age for lots of different reasons. For me, it flared up during both of my last pregnancies, and then it went away, and recently it's back. Of course, we're all under a lot of new stresses during the last few months, and as you'll see as we go along, that can be one of the causes of tinnitus.
How do you spell that?
Tinnitus, T-I-N-N-I-T-U-S.
Thank you.
So if y'all want to jump in with questions, please do. You do not just have to listen to talk for the next 30 minutes. Okay? So good question. So first of all, what is tinnitus? It's any sound that you're hearing in your ears that's not really happening in the environment around you. Now, it can be anything from bells, chirping, whistles. Some people even hear singing. There are lots of different sounds. None of them are more alarming than another. It can be perceived in just one ear, in both, or it can feel central to the middle of your head. Hissing and buzzing are the most common sounds that I have patients share with me that they hear. Most often they hear a high-pitched buzzing that just doesn't go away. Now, for some people it comes and goes. It can be intermittent. For others, it's constant and it never goes away. For most people, they find that when things get quiet, especially before they go to sleep at night, that is when the tinnitus starts to flare up more. So what are some of the causes of tinnitus? 80% of people who have a sensory neural hearing loss, and that's the most common type of hearing loss you can have, 80% of them have some form of tinnitus. So you can imagine a lot of people who make it through my door because they might think they're having some hearing issues, the tinnitus goes hand in hand with it. Now that doesn't have to be the case. Like I told you, I've had it, and I personally don't have any hearing loss right now, but it was caused by other factors. So hearing loss itself is basically a damage to the inner or the middle ear. And some of the testing that we do in the office is to determine where is a hearing loss actually happening. The most common place that tinnitus is going to flare up is because of an inner ear hearing loss. So just like this text says, it's almost like a phantom limb syndrome. You're hearing a sound and it's not really happening. Other causes of tinnitus. So when somebody comes in the office presenting with some sounds in their ears and they want help with them, the first thing we start doing is going through some of these questions to see if there are some lifestyle things that they could change that might have an impact on it. I don't want to just default to say, it's caused by your hearing loss, here's how I would fix it. I want to see if there are other things that we could try first. So the most common reasons are going to be wax in the ear canal. Sometimes when your ear gets totally occluded with a block of wax, you can experience it, or fluid behind the eardrum. So sometimes it'll just flare up while you have an ear infection or bad sinuses. There are some concerning reasons that tinnitus could flare up. For instance, an acoustic neuroma. You can have tumors and crazy things in the head that can cause it, but those are extremely, extremely rare. Some medications, we've got a long list of side effects on the medications that we take. Sometimes tinnitus or hearing loss fall at the bottom of that list, but do not just stop taking anything. Talk to your doctor first. One of the more common medications that I ask people about is going to be painkillers. So aspirin specifically is known to cause tinnitus. And many people are taking some small amount of aspirin on a daily basis. Don't stop taking it, but just know that it can be linked. You can see there are other drugs on here too that can cause it. There are a lot of musicians who have tinnitus. And if you saw that movie that came out in the last couple of years with Lady Gaga in it, the main character, that male musician, he was experiencing tinnitus and he was having such a hard time dealing with it emotionally. It was causing depression and a lot of other issues for him. And all of us in my field, we saw the movie and we're thinking, oh my gosh, I wish he would see somebody about it and recognize it's something that can be lived with happily and possibly improved too. Next thing to know is that you are not alone. Tinnitus is so very common. 22 million Americans, 10% of the adult population. And you can see that as the age demographics go up, so does the prevalence of the sounds. I would also tell you that is also caused by hearing loss percentages going up as well. So 1/3 of people over age 65 have a treatable hearing loss. 1/3. When you get to age 70 though, it jumps up to 70% of people over age 70. Now you don't see 70% of 70-year-olds wearing hearing aids because people have hearing losses that they choose not to treat, but that is the amount of people that actually are having some difficulty. There are two main types of tinnitus. The most common, of course, is subjective. You hear something in your ears, nobody else can hear it. It's that phantom sound that your inner ear is creating. There's a very rare type, objective tinnitus. So I always like to ask people, when you're hearing this sound in your ears, is it pulsing? Does it feel like it's going along with your heartbeat? If that's the case, they probably should get a workup with their primary care physician and make sure that there's not some other underlying condition that's causing that sound. You can imagine if you had something going on, even a blockage in your head, cardiovascularly, you might hear the pulsing of blood flow if it was happening really close to the auditory system. Extremely rare. Some of the other reasons, we just talked about vascular reasons, but you could have muscular issues as well. Also very rare, but if we have something that is a muscle that's pulsing, that's not supposed to be doing that, a eustachian tube malfunctioning, then you might hear it in a more rhythmic tone, which is not very common. So only about 20% of people with tinnitus are bothered by it. I have many people that come in and tell me, oh yeah, I hear that sound, but whatever, I ignore it. That's a great attitude. For the most part, when you start hearing some tinnitus, it doesn't go away permanently. People who wear hearing aids find that they get a lot of relief from it. Some get total relief while they're wearing the hearing aids. But the most important thing I want you to take away from this talk is the way you view it, the way you wrap your head around it being kind of a friendly sound that follows you, but it's not an indicator of anything harmful. Your attitude is what's going to help it actually be soothed, not quite so inflammatory. It's your reaction to the problem that actually makes it worse. So when people do get hearing aids for the first time, if they're hoping that it's going to reduce the tinnitus, usually when I put them on them in the office, they go, yeah, it's not any lower. I hear it just as high. And I tell them it's going to take a couple of weeks. When you put on a pair of hearing aids, now everything is focused on what you're hearing. You're putting so much attention on the sounds and on your ears. If you think about your ears right now, don't they perk up and don't they feel more capable of hearing a pin drop? That's going to make tinnitus flare up even worse. Once you've gotten used to a pair of hearing aids, once they have faded into the background and just become a part of your body, a week, 2 weeks into it, a few days go by and then you go, oh, I haven't really thought about my tinnitus in a few days. That's funny, because you've been able to relax. So stress certainly makes it flare up. So there are a few options for tinnitus treatment. Rarely would someone go in for a surgery to fix it. That would be related to a vascular issue or potentially a tumor. Extremely rare. Sometimes people take medications to reduce their stress level. Dietary restrictions. So some of the things that make it worse are going to be caffeine, alcohol, salt, MSG. So all the things that help us live a healthier lifestyle, getting more sleep, eating less sodium, all of that is going to improve it. Masking is something that many people use as a tool to cover the tinnitus without even realizing that they're doing it. Some people play the TV or a radio to help them fall asleep at night, or they turn up the air conditioner, or they have a box fan or a noise machine. Sometimes they don't even realize they're doing it to cover the tinnitus, but it's very effective and there's nothing wrong with that. It is a wonderful coping mechanism. Down the way, I have a recommendation for one of my favorite noise machines. There are a few therapies, different types of counseling, and I'm happy to refer you for sources to those. You can reach out after this presentation and I can go into those more in depth. But most of these therapies are going to require multiple visits to a provider. You go through a course of treatment it can be anywhere from a few months to even a year, but it's for the more severe cases where the other modes of treatment haven't helped. I'm going to pause for just a second. Does anybody have any questions about what we've talked about so far?
Very clear. Very clear.
Great. Okay. So let's talk.
I'm sorry, I have one question, and I chimed in just a little late. So
Please.
you can have the tinnitus without a hearing loss?
You can.
Okay.
I am evidence of that. You know, I worked in this field for years, never having experienced it myself, just helping treat people. And I have a 2.5-year-old. So the first time I experienced it myself was almost 3 years ago. And I had it for several months at a time with each pregnancy. And I think it's very common, especially when you have something health-wise come up like that, for it to come and go. And then during periods of stress, it can come and go too.
Wow, interesting. Okay, thank you.
I read an email that talked about tinnitus, and it said there were a lot of herbs and things, or hibiscus berry, hawthorn, garlic, niacin, B6. Does any of that stuff help?
I have had many patients come to me with those lists. I can't say empirically that they work, but I wouldn't say that they don't either. I mean, I would be cautious to take anything in excess of a normal diet, but, you know, putting more garlic into your diet or that kind of thing, it's not something that I can speak to as working in my experience, but I wouldn't negate it either. I very much believe in healthy nutrition having a good impact on our overall health.
And ear drops mess your ears up. And also if you use those trimmers for like your ears, you know that, can you damage your ears like that for the hairs in them?
You said, first of all, ear drops.
Yes.
Are they for ears? Are they for like swimmer's ear?
For your ears.
Yeah, well, they won't hurt anything. Actually, if you look down the ear canal, most people haven't seen inside an ear. It's kind of hard to see that far, right? But as you look down an ear canal, it's actually a closed system. So you've got a tunnel and an eardrum. And your eardrum is a flat, solid piece of skin. Nothing can get past it. So people think, you know, I'm putting something in my ear. What if it goes all the way in? It can't go past the eardrum. Putting things in your ear after swimming, especially to dry up the water, there's nothing wrong with that. I just like for things to either be already over the counter and meant for ears or well diluted. So if you use white vinegar or hydrogen peroxide, that's wonderful. Cut it with a lot of water because those things can actually burn your skin if they touch directly without being diluted.
What about those,
Question?
where you trim your ears? Can you damage that hair down there with those little trimmers?
No. Great question. So we learn a little bit about hair cells and how those are related to hearing. So hair cells, when we talk about those, they're actually microscopic cilia that are down in your inner ear. They are inside your skull. There's no way for you to get to that. So as far as like external hairs, totally different than the internal hair cells in your inner ear. And since I'm on that little rabbit trail, I'll just say that is how hearing loss happens. We have these little hair cells in our ears, and they're perked up, and they are matched to different frequencies. They pick them up, they hear them, and they send the signal to the brain. When we have things that cause hearing loss, whether it's noise damage, medications, aging, genetics, each of those things can cause those little hair cells to get bent. And when they're bent, they just don't pick up the tones like they should. Right now, we don't have a way to treat those hair cells. They're doing studies in rats right now for medications, treatments, and one day I'm sure we'll be able to regrow them. But at this point, if a hearing loss is significant enough, a person can get a cochlear implant. That's major surgery, and they have to have a pretty profound hearing loss. And for anyone less than that, that's where we go and we use amplification, so hearing aids, to reach those hair cells.
Thank you.
All right, I'm gonna just jump back in here. So masking. This is what I referenced a little earlier, using a white noise machine or something like that to raise the ambient noises in the room so that you can't hear the sound inside your head as much. There's nothing wrong with that. You're not gonna harm your hearing by doing it. Masking can be done with something external, a fan sitting in your room, and it can be done in a hearing aid. So I'll get back to that in just a second. There are two major types of hearing aids, and I'm going to get into this a little bit because it is a treatment for tinnitus. We went through some of the other things that you can try. But if you are experiencing tinnitus, and especially if you're over 60, you should have a hearing test. Let's make sure that it's not related to a hearing loss. If it is, changing your diet, looking at your stress level, all those things can help. But doing a trial with hearing aids may help as well. So there are two major types of hearing aids. There's the type that goes behind your ear. It also has a little tail with a little wire that goes down in your ear. And the second type is the kind that goes just in your ear canal. I think of it like a coffee bean. Okay? Now, with either of these, there's two ways that it helps with tinnitus. One, it raises the ambient noises in the room. So if you were having trouble hearing soft sounds, soft talkers, high-pitched voices, by raising those sounds, you essentially are masking the tinnitus. It's still there, but it's not bothering you. The second way, if we don't achieve enough of a good result with that, is by literally turning on a masker in the hearing aid. So it's a sound that the hearing aid's playing that's more pleasant and cancels out the sound of your tinnitus. It can be a white noise, it can be ocean waves. There are lots of sounds that people might choose. Different ones will be more effective for different types of tinnitus. So as a quick note, you can see on the screen, these behind the ear hearing aids, for instance, they can be rechargeable. So you just charge them overnight and you put them on in the morning. They can connect to your smartphone. So if you are tech savvy, you can stream from your phone. And a lot of tinnitus users really like that. They can stream any type of sound, any kind of music to their ears an hour a day or all day long. I have a few patients who are listening to audiobooks while they're sitting in waiting rooms, and they're listening to music all day while they're at work. As far as in the ear hearing aids, this is an example of a very small one. This is called an invisible in the canal. You literally can't see this hearing aid. It's so small. It's not for everybody. You have to have dexterity, and it does use a small battery. So there are sizes that are larger than this. But I've had more and more people choose in the ear hearing aids lately because of their masks. When you wear a mask, you can pull off an over the ear hearing aid. You just have to be so careful when you go in and out of stores when you take that mask off. And in the ear doesn't get disrupted. There's no wrong type of noise machine, but I'll say I really love this one. I have 4 of these in my house, and they're recommended by a lot of my colleagues. This is called the Dome, and it's available on many different sites, including Amazon, for $30 and up. It actually has a fan inside it, so it's not making a noise itself. It's a fan, and as you twist the top, you can change the frequency from a higher pitch to a lower pitch fan. So even from night to night, you don't get bored. You can kind of change it as you want to. And we may be able to make this document shareable for you later, but I just wrote a little bit about the practice, and I just put a link if you want to look at any of my other videos about questions you might have about hearing loss, hearing aids. You can check out my YouTube channel too. So y'all, please tell me, what other questions do you have for me?
I have one.
Okay, let me see if the mic's on. Hang on.
I have,
Yeah. Oh, you got muted. I think Bob muted you.
Story.
nothing personal, I'm sure.
Did it-
Hold on.
You got her muted again.
Yeah, Miss Metzler, unmute yours and ask me your question. I couldn't hear you.
Can you hear me now?
Yes.
We're pushing Bob out of the way, away from the mouse.
I'm a technical guy.
I have wax in my ears and I don't have hearing aids, but I'm pretty sure I need them. What's recommended for people that have the hereditary wax?
Yeah, a lot of it's genetic. It has nothing to do with what you do or don't do. It's just,
Oh, I know, it's passed down. I passed it to some grandchildren and made their parents very unhappy, but it is what it is, yeah.
yeah. So first of all, hearing aids, they live in a hostile environment. They live in a dark, moist, waxy place. So the cleaner that we can keep an ear, the better the hearing aid will operate.
Sure.
I have a great routine that I have been giving to people for years that helps them actually keep their ears cleaned out at home. It's really simple and not obtrusive at all. But I do think starting with a clean ear is the best way to be successful in a hearing aid. All of them now are also going to have a filter at the end where the sound comes out that will catch wax before it gets into the hearing aid to protect it. So you can change that filter very easily yourself at home. It's popping off one and popping on a new one. And for most people, I ask them to change it once a month.
Right.
For people who have more of an issue, they might change it even once a week, but it's a cheap little tiny plastic thing that is really easy to change.
Yeah, because I flush out the ears and use the earwax treatments and try to keep them clean, but it's just one of those things. Yeah.
It is. I've seen all types of ears and all types of wax, and I have a really good routine, and I'd be happy to share it with you.
Okay, thank you.
A great document that has all the instructions written out.
Good. I like that. Thank you.
Yeah, no problem.
Not a question, but to me, a humorous. I was reading a Buddhist book by a Buddhist monk, and he had tinnitus, and he thought it was a sign of advanced spirituality.
I like that. I think we should all think that. The next time you hear some tinnitus, you should just think, gosh, I'm advanced. Man, am I spiritual. And it'll be positive and kind of funny, and that's great. I love that. I might have to start sharing that with patients.
This is the YMCA. No, that's her slide. She's a she's a optometrist. No, it was a hearing aid person. No, that's I. Yeah, or Arboretum.
All right, I'm not sure who's talking, but does anybody else have questions for me? I'm happy to answer them about tinnitus. Yeah.
Hi.
Hi.
The band sound is extremely loud all evening and night. I've tried the steps you mentioned, and it takes forever for it to simmer down.
You're saying the tinnitus is very loud at night?
Extremely. Like a band playing or a really bad rainstorm.
Wow. And have you had your hearing tested?
Yes, it's fine.
Okay. I think the next step there would be seeing an ear, nose, and throat doctor. And I am happy to refer one for you. But you're in a special group, and the volume is something that is harder to deal with. I think that using the sound machines would be really important for you to try to get it to relax and to tone down. But I also referred to those therapies earlier. And for people that have more than just a mild or moderate case of tinnitus, those therapies can just be life-changing. I also have some referrals for those too. If anybody wants to reach out to me after this, in case this isn't clear somewhere else, levinehearing@gmail.com is my direct email. It's levinehearing@gmail.com. So I'm happy to send you all the referrals or the documents that I've said, because I'm not sure how I'm going to get it to you guys individually.
I'm gonna put it in the chat box.
Okay, thank you.
Levine Hearing
Thank you.
Gmail.
Mm-hmm. You got it. All right, do y'all have any other questions for me? I'm not.
Anybody else today? Good. Well, Madison, thank you so much for coming on with us today. We really appreciate your time and the information. Linda, did you have a question?
I do. Just can
Okay.
you give me a bit of a teaser of what those therapies are for the tinnitus? I don't experience it yet, but I think, wow, all the other helps, but then what are those therapies?
Yeah. So there are a couple ways to go. At the most basic level, there is some cognitive therapy. So how you view the tinnitus itself, how you think about it. And I don't perform the therapies myself, so I'm giving you just an overview. So cognitive behavioral therapy is one. But the sound treatments in neuromonics are really interesting. So those can be several months long, but it's playing certain sounds that are helping your ear learn to relax and to block out the sounds that you're hearing. So I do test for the tone, pitch, and volume that your tinnitus is. We try to match it, and that gives us great information. You might think that you have a low-pitched tinnitus, and then when I put you in the sound booth, we find it's actually at 4,000 hertz at 25 decibels. Knowing where it is on a chart helps us figure out how to start canceling it out through sound therapies.
Oh my gosh. Okay.
Yeah.
Thank you.
Yeah, okay. That was a teaser enough.
Yeah.
Okay.
All righty. Anybody else have any questions for Madison today? Well, thank you so much, Madison, for being with us.
Yes, thank you.
Very much a pleasure being here with us and keeping us connected. We really appreciate your time and the information. And you guys know that in the chat box, I sent you Madison's email address. If you look down at the bottom of your screen and hit on chat, you can copy down her email address, or feel free to send me an email requesting that, and I can share it. And I'm happy to share anything, through Madison. You can email me. I'm assuming you all here that are on this are getting my Monday updates. So I hope, and if you're not, please let me know. And if you want to be on those Monday updates that kind of let you know what's going on and whatever updates are from the Y. Again, I guess you guys did realize that the governor did pretty much keep everything the way it is. He spoke yesterday, and nothing's changing for the next 3 weeks because of our cases. So unfortunately, or fortunately, I guess, depending on how you look at it, I mean, fortunately that maybe we won't be spreading the disease any faster, and we can kick it back to the curb some, but the Y will pretty much be staying where it is with the doors indoors closed. But we did add some more classes this week. So that's a positive thing. Where's that coming from? So I just hope that if you have any questions, the app is the best. If you're interested in signing up for anything that's there, the app is the best way to go. You can also do it online. If you're struggling with any of that, please let me know. Maybe I can walk you through it. And if you're having other issues, please just, you can actually go by the Y, and membership will help you out there too, because they are there to help you if you should need it. But next week we will be here together again. Next week we're going to have a bunch of Y wellness people, trainers, whatever. So it'll be kind of an interactive opportunity to share and talk, and we'll be here same time next week. I keep putting out the calendar as I book things. I've booked pretty much the next month, so I will kind of keep you informed about what our programming is going in. And if you have ideas that you want me to look at later, please let me know. So I just want to tell you it's great to see your faces. Don't hesitate to reach out if you need anything. And I'm just really grateful for seeing all you guys today. So it's nice to stay connected together. And Madison, once again, thank you so much for being with us today. We really appreciate your time.
Thank you.
All right, guys, take care. I hope to see you all next week. Feel free to invite people. We have room to have other people. If you know friends and family that would benefit from just getting together with us, don't hesitate to send them the link. So thanks so much, guys. Take care.
Bye, everybody.
Bye, everybody.
Thank you.